Our research question is, do adding mindfulness and yoga principles to a physical activity intervention improve the outcomes for endometrial cancer survivors and their support teams? Mindfulness is the idea of being in the present moment and using deep breathing to center oneself. Yoga complements this nicely as it focuses on different aspects of the body and merges nicely with the idea of mindfulness and one individual being centered. We realized this need for endometrial cancer survivors through several different methods. The first being a literature review that shows that endometrial cancer survivors have worse quality of life and functioning than women of similar BMIs who do not have endometrial cancer. We further explored this through a questionnaire that was sent to all endometrial cancer survivors treated at Carilion Clinic within the past 10 years. Based on that data, we then grouped endometrial cancer survivors into focus groups to dig deeper into what principles and different aspects of a lifestyle intervention would be appealing to them. What we found is that endometrial cancer survivors desire support and more of a wellness focus as opposed to a weight loss focus. And these different aspects of an intervention fit very nicely with the idea of mindfulness, being in the present moment, and the yoga principles that allow moving the body and being really grounded in oneself. So, knowing that endometrial cancer survivors are interested in ideas and things like mindfulness and yoga, we incorporated it into one of our intervention arms. So we have a standard of care group that's endometrial cancer survivors that are just going to get paper and newsletters that have the recommended guidelines for physical activity and diet. A second group has the FitX intervention that focuses on walking. And the third group is our FitX intervention with a mindfulness and yoga focus. The mindfulness and yoga principles are interwoven into weekly emails that the participants will receive, as well as into their 30-minute sessions that occur once a week. 15 minutes of the session involves yoga or exercise, and the other 15 minutes is a group discussion. I think it's important that we include mindfulness in yoga. There's a lot of data about this in the general public. There's been data showing benefits for patients that have chronic diseases, those that have obesity, those that live in rural settings. But there's been no interventions to our knowledge thus far that have kind of identified this whole group of individuals that make up the composition of our patient and apply these principles to them. We're hoping that our mindfulness and yoga group is going to have an increased amount of self-love and self-compassion, flourishing, improved quality of life that will exceed that of the control group, but also of the group that has solely an exercise or walking focus. Our study is unique in that endometrial cancer survivors recruit support team members to go through the intervention with them. And so there's a multi-level effect that we expect from this intervention. Number one, on the endometrial cancer survivor herself. Secondly, on her support team and her environment that's around her. And then ultimately, hopefully nationally, if this study is efficacious, we hope to roll it out across the country to provide this opportunity for other cancer survivors.